So one of the most rapidly growing and one of the most exciting new niche fields in plastic surgery is what I call feminine rejuvenation. It's also known as labiaplasty, vaginoplasty, vaginal rejuvenation, and so on. And there are two aspects, or I should say maybe 3 or 4 aspects of this surgery that are becoming more popular. One is the cosmetic portion of it, and that's usually an external, where the patient has large external genitalia and they want to be more trim, they want to feel more comfortable in clothing, and so on. And so under general anesthesia, we trim the external genitalia. It's an easy procedure to have done. It's the kind of thing that you can do that on a Friday and you can go back to work on Monday. That's the labiaplasty. The vaginoplasty portion is an internal operation. You can't see anything from the outside, but basically what we do is that I go in and I tighten the vaginal canal. The lady I did yesterday, she had had 4 children, 4 large pregnancies, vaginal deliveries, and she and her husband were very dissatisfied with the mismatch of their body parts during sexual intercourse. And so what I can do is I can go in and I can tighten the woman's vagina, and it makes for more friction, it makes for greater satisfaction. It's an operation where both partners are very happy. The vaginal rejuvenation is probably the most exciting because with the traditional vaginoplasty, it's 8 weeks before they can start having sexual relations again, which 8 weeks is a long time. But there's also a new treatment, which is a non-invasive treatment, where we use a heat probe and we tighten the walls of the vagina with a heat probe. And with this non-invasive procedure, which is not quite as effective as the surgical procedure, but there's absolutely no downtime. There's no need for anesthesia. There's no need to abstain from sexual intercourse. They can have intercourse that night if they want to. And so I predict that will be a really big game changer in the game of feminine rejuvenation.